Good morning, nurses. I'm here to talk about family dynamics, and we're going to briefly touch on genetics, genomics, very briefly at the end. And lots of good information in this PowerPoint and in this presentation. So remember that family really continues to be a central institution in American society. And even though our definition of family might have changed, we still gear a lot of what we do towards family. So our outcomes today are to examine current family trends, common family forms, and life cycles, to identify factors that influence family forms, to discuss the impact of health and illness on family relationships and roles, and hopefully in clinical, you got a good start on being able to assess family involvement and care of the residents in the long-term care, and then to identify genetic factors that influence the health of a family. So there's a video here. Well, let me come back here. So definition of family is a set of interacting individuals related by blood, marriage, or adoption, who usually live together and fulfill functions of socialization, division of labor, and economic provisions, and cooperatively meet affective, emotional needs of the family within the family unit. So it doesn't have to be a legal adoption. Your family you can be adopting friends along the way as well. So lots of different definitions of family. And so as we go through, you can think about who is your family. Who do you include in your family? What strengths, resources, weaknesses, and challenges are part of your family? With which family members do you share health decisions? And that's going to help think about your experience and start to consider how those things work in other families, your patients' families. So here is a video. You can watch that on your own with the link in Moodle. And so we'll talk about family forms. So a nuclear family consists of a husband and a wife and maybe one or two or more children. Extended family includes relatives like aunts, uncles, cousins, grandparents, in addition to the nuclear family. A single parent family is formed when one parent leaves the nuclear family because of death, divorce, or desertion, or when a single person has a child, whether through birth, through adoption, through however. A blended family is formed when parents bring unrelated children from prior relationships into a new joint living situation. An alternative family can include a multi-adult household, a skip generation family, so an example of that would be grandparents raising grandchildren, communal groups with children, non-families, or so just adults living alone together, and cohabitating partners. Family is a network of individuals regardless of actual biological or legal ties. Family trends and forms in the United States that impact healthcare of the family and the individuals in the family. Divorce rates have tripled since the 50s, and it is estimated that 50% of all marriages will end in divorce. So this does affect health of children and of parents. The number of single-parent families appears to be stabilizing at about 26% of families with children, although mothers head 83% of single-parent households. Father-only families are on the rise. 41% of children are living with mothers who have never married. Many of these children result from adolescent pregnancy. The majority of adolescent mothers continue to live with their families. A teenage pregnancy tends to have long-term consequences for the mother and often severely stresses family relationship and resources. In addition, there's an increased risk for poverty for the family. Although unable to marry by law in all states, homosexual couples define their relationship in family terms, as they should. Approximately half of all gay male couples live together, compared with 3/4 of female gay couples. So when we look at what influences family forms, in other words, what makes up the family, we tend to look at several areas. The first is almost the biggest, which is changing economic status. Families at the lower end of the income scale or lower socioeconomic status and single-parent families are vulnerable. They have fewer resources. They might have no health insurance, or they are under health insured, and they have difficulty accessing health care. Homelessness is the fastest growing segment of the homeless population is families with children, which is really scary. This includes a complete nuclear family and single-parent family. Children of homeless families are often in fair or poor health. Usually they only have access to health care through emergency departments. Homeless adults tend to have poor nutrition and limited access to health care as well. One thing I want to mention here is dental care for homeless families, homeless people. They often have poor dental care and poor dental hygiene, which can lead to increased health problems overall. Domestic violence. The cause of family violence is complex and multidimensional. Stress, poverty, social isolation, psychopathology, substance abuse, and learned family behavior are all associated with violence. Each family is unique in its structure. The function of family is also multidimensional. It's physical maintenance of the people in the family. It provides protection, provides nurturing, socialization, education, reproduction, and recreation. When we want to look at the family and talk about who is in the family, who performs tasks and makes decisions, there's a really good table in your textbook on page 651, which is Focus Patient and Family Assessment. And one of the biggest questions that I have asked as a nurse a lot of the time is resources. And there's some really great questions, such as, do you have relatives and friends who do not live with you in your home, who can support you? How do you cope? How does your family cope with illness? And those are really good questions to ask, especially if you observe a lot of conflict in the family. Developmental stages of the family, just like individuals, just like we talked about in growth and development, families go through development too. And there is a basic pattern and similarity in experience, resulting in predictable stages. And if you look in your textbook, page 648, Stages of the Family Cycle, you'll see something that looks fairly similar to our growth and development stages. And you can take a look at those. I think it is important to know, starting with unattached young adults, joining of families, family with young children, family with adolescents. Now, there are some families who never end up having children, and they are still families. They just go through the stages differently. Each of those stages has its own challenges, needs, and resources, and includes tasks that need to be completed before the family is able to successfully move on to the next stage. Multiple factors influence the health of a family: social resources, economic resources, location and environment, as well as genetic factors. Family beliefs, values, culture, and practices influence health promotion and disease prevention. Some families do not place a high value on good health, whether that could be nutrition, exercise, smoking, oral hygiene, another example. Genetic factors reflect a family's heredity or genetic susceptibility to a disease that may or may not result in actual development of the disease. Hardiness and resiliency are factors that moderate a family's stress. Family hardiness is the internal strength and durability of the family unit. Resiliency helps to evaluate healthy response and coping when individuals and families are experiencing stressful events. There are different approaches for family nursing practice. Family as context, where your primary focus is on the health and development of an individual member of the family existing within a specific environment. Although you focus the nursing process on the individual's health status, you also assess the extent to which the family provides the individual's basic needs. Family as patient, the family processes and relationship, for example, parenting or family caregiving, are your primary focus of care. So you focus your nursing assessment on family patterns versus individual member characteristics. And then family as a system is a newer model and includes both relational and transactional concepts. When you care for the family as a system, you are caring for each family member, which is family as context, and the family unit, which is the family as patient, using all community, social, and psychological resources. So overall, the family is influenced by resources, location and environment, beliefs, values, and culture, hardiness and resiliency, and we can influence family stress as nurses, and then genetic factors. So I missed a slide here, family and health continued. So families are also influenced by acute and chronic illness. And as a nurse, we can help the family prevent or manage medical crisis. We can identify resources for the family or individual members within the family. When it comes to trauma, we need to make sure that trauma is an unplanned event, and family members need to cope with the challenges of a severe life-threatening event, which can include the stressors associated with an intensive care environment, anxiety, depression, and economic burden, not to mention the impact on the family's functioning and decision-making. End-of-life care. At times, a family member becomes terminally ill. Even if family members are prepared for their loved one's death, their need for information, support, assurance, and presence are great. So remember, the nursing process is the same whether the focus is family as patient, context, or system. Areas included in family assessment are form, structure, and function of the family, its developmental stage, and its progress toward accomplishment of the developmental tasks. You begin assessment by considering the views of a patient toward the family. Family structure provides information about composition of the family, so whether it's a nuclear family or extended family or skip generation, who's the head of the household, who earns the money, and brings resources into the family, how decisions are made, including health decisions, who maintains the household and environment for the family. To assess family functioning, ask questions to determine the power structure and patterning of roles and tasks. Family's culture influences structure and function. Health practices and family celebrations help you design family-centered care. To determine the influence of culture on a family, you ask a patient about his or her cultural background. When you establish a relationship with a family, it is important to identify potential and external resources. Together with your patient and his or her family, develop a plan of care that all members clearly understand and on which they mutually agree. You base a positive, collaborative relationship on mutual respect and trust. When assessing a community, you determine the presence of healthcare resources, proximity of emergency services, and municipal services like Meals on Wheels, low-income housing, etc. Families, like individual patients, have expectations for care. Some families expect to be consulted as a whole unit when discussing care of a loved one, and others wish to have a designated decision maker. Determining expectations early in the assessment helps to avoid problems resulting from misunderstandings in the future. So again, to assess a family, you're going to use those focused patient and family assessment on page 651 questions, and look at those resources, their patterns, and what is the function? Sometimes a family has a short-lived function, and sometimes it's long-term. And you want to know how illness changes that family. Setting priorities focuses on a patient family unit, or a family alone. It is imperative that family and patient clearly understand and agree on the plan of care and priorities, because the priorities for a patient and the priority for the family are sometimes different. Collaboration with all appropriate family members when planning care is essential. By offering alternative actions and asking family members for their own ideas and suggestions, you may help reduce the family's feeling of powerlessness. Collaborating with other disciplines such as physical therapy or social services increases the likelihood of a comprehensive approach to the family's healthcare needs and ensures better continuity of care. So as a nurse, activities we're doing with families and patients in families are health promotion activities. And when we think about topics for health promotion activities, it helps to look at that family developmental stage. Are there young children, teenagers in the house? Are there no children? Is there a chronic disease in the family? Things like that we can really help them recognize their strengths especially when we're using that family-centered care and the ability to work together. And sometimes we can really help a family tear down some walls they have together. That synergy model is really believing that when we are providing patient-centered and family-centered care, that we really are integrating our skills and knowledge to have what we need is the best care to help that patient and family work together with the nurse, and that creates a synergy, and the patient outcomes are better when we have that synergy. Discharge planning, which begins on admission, definitely in acute care. Sometimes in long-term care, it's not a plan for the patient to be discharged. So that is an option as well. Communication between decision makers, whether that's the head of the household, the patient, or together, that communication is very important. And then family caregiving, we do a lot of that because we have an aging of our population. And there are a lot of families whose children are taking care of aging parents, adult children, obviously. We have what we call the sandwich generation, which is taking care of older parents and younger children. We have a lot of younger adults who continue to live at home for economic reasons mostly. And so there's a lot of family nursing that goes on that we just don't realize. When a patient's family functions as the context, the evaluation focuses on attainment of the patient needs. The evaluation is patient-centered, although nursing measures have involved helping the family adapt to the new normal. When the family is the patient, the measure of family health is more on an evaluation of health of all family members. You evaluate a family's change in functioning and its satisfaction with the new level of functioning. When you care for family as a system, evaluation focuses on effects that interventions have on the entire family, including extended family often. Evaluation is an ongoing process. It is important to obtain the family's perspective of nursing care, how you planned and delivered the care for them, whether it was satisfactory, whether you had the outcomes you were striving for, and whether it met the family goals. So I want to switch gears a little bit to talk about genetics and genomics. So first of all, genetics is the study of heredity, the study of genes. And so examples of that would be studying diseases like Huntington's disease, which is affects the nervous system, von Willebrand's disease, which affects blood. And you really need to get a thorough family history when you are studying genetics. And it's not just blood, it's that family history that's really important. So communication, when you're studying genetics, extremely important. There's a really good article in Moodle that's called Genetics in the Clinical Setting that might help you understand the nursing implications for genetics a little bit better. And I'm going to talk about genomics for a moment. So there's a video for you to watch that probably explains it much better than I can. But we know that genomics is more than just the study of genetics. So genomics is the study of all the genes in the person and the interaction of those genes with one another and with that person's environment. So genomics influences healthcare because providers can determine how genomic changes contribute to patient conditions and influence treatment decisions. So, and let me answer the next question, and then we'll talk about an example. Genomics can determine risk for diseases, and the patient can receive counseling before a disease or process or illness occurs. Nurses need to learn how this works and continue to stay informed because technology is increasing all the time. So one example of the study of genomics is generational trauma. So I don't know if you've heard that term before, but generational trauma is something that happens to a group of people. And there's a couple examples out there that we can look at. And one is Native Americans, and another would be European Jewish population after World War II. And when we see those genes, it is not that the genes themselves have changed, but there are chemical changes that happen that affect how the genes function. And so the question is there, for example, in the European Jewish population after World War II and descendants of those people, do they have an increased risk for anxiety, depression, or other mental illnesses that could have been caused by what happened just before and during World War II to them. And so there's been a whole list of studies done, and there's so much more information coming out about how genomics influences the health of a person. And I hope to continue to learn about that as we go through in time. So that's it for family dynamics, and I will see you in class.